Welcome to Lungs Anatomy Part 1, presented by Dr. Vishnu.
Lungs are like sponges, designed to soak up air. But some people use their lungs to soak up cigarette smoke. If you could wring out the cancer-producing tar that goes into the lungs of a pack-a-day smoker every year, this is how much you'd get. It's enough to make you sick. Very sick. Authorized by the New South Wales Government, Sydney.
Please note this sobering statistic. 1,000 Americans and the same number of Indians stop smoking every day by dying. Smoking is known to cause severe health issues, including throat cancer, as shown on these warning labels. Consider this case scenario. A 62-year-old male with pre-existing conditions was admitted with fever and cough. He tested positive for COVID. His oxygen concentration began to fall, and a CT scan showed bilateral infiltrative shadows in the lower lung lobes. The physician advised prone positioning and oxygen saturation monitoring. This scenario raises several questions regarding the probable diagnosis, the causative microorganism, why the lungs were involved, which lobes are most commonly involved, the reason for falling oxygen saturation, and the rationale behind prone positioning. Our learning objectives for this video include describing the gross anatomy of the lungs, its surfaces, borders, hilum and root, fissures and lobes, bronchopulmonary segments, blood supply, lymphatics, nerve supply, and clinical anatomy. The lungs are a pair of spongy respiratory organs separated by the mediastinum. Their color changes with age, from pinkish at birth to mottled black in adults due to carbon particle deposition. The right lung typically weighs about 700 grams, and the left about 600 grams. Each lung is conical and features an apex, a base, 3 borders, anterior, posterior, and inferior, and 2 surfaces, costal and medial. The medial surface is divided into vertebral and mediastinal parts. The apex lies above the first rib, about 2.5 centimeters above the clavicle's medial third. The base rests on the diaphragm, separating the right lung from the liver and the left lung from the liver, stomach, and spleen. The anterior border is thin and sharp. The left lung's anterior border features a wide cardiac notch below the 4th costal cartilage. The posterior border is rounded and blunt, corresponding to the medial margins of the ribs, extending from the 7th cervical to the 10th thoracic spine. The inferior border separates the base from the costal and medial surfaces. The large, convex costal surface is in contact with the costal pleura. The medial surface is divided into vertebral and mediastinal parts, with the mediastinal part showing the cardiac impression and the hilum. This diagram provides a medial view of the right lung, illustrating the superior, middle, and inferior lobes, as well as various grooves and impressions. This image displays the medial view of the left lung, highlighting the superior and inferior lobes, the oblique fissure, hilum, and cardiac notch. Here we see the key impressions on the mediastinal surface of the right lung. This illustrates the important impressions on the mediastinal surface of the left lung. The right lung has 3 lobes, upper, middle, and lower, divided by oblique and horizontal fissures. The left lung has 2 lobes, upper and lower, separated by the oblique fissure. The lingula on the left lung corresponds to the middle lobe of the right lung. The following slide highlights the differences between the right and left lungs. Key differences include the right lung having 2 fissures and 3 lobes, while the left has 1 fissure and 2 lobes. The right lung is larger and heavier, while the left is smaller, lighter, and longer. The hilum is the region on the medial surface where structures enter and leave the lung. The root is a short, broad pedicle connecting the medial surface to the mediastinum. The contents of the root include the principal bronchus on the left, eparterial and hyparterial bronchi on the right, 1 pulmonary artery, and the superior and inferior pulmonary veins. Additional contents of the root include bronchial arteries and veins, anterior and posterior pulmonary plexuses of nerves, lymphatics, bronchopulmonary lymph nodes, and areolar tissue. The anterior to posterior arrangement of structures in the root is similar on both sides: superior pulmonary vein, pulmonary artery, and bronchus. The arrangement from above downwards differs. On the right side, it is eparterial bronchus, pulmonary artery, hyparterial bronchus, and inferior pulmonary vein. On the left side, it is pulmonary artery, bronchus, and inferior pulmonary vein. This slide is for illustration purposes to help visualize the arrangements. In clinical anatomy, bronchogenic carcinoma, a type of lung cancer, is commonly caused by cigarette smoking. It often spreads to the bronchopulmonary and supraclavicular lymph nodes, as well as via blood to organs like the brain and bone. Enlarged supraclavicular nodes can be an indicator for screening. COVID-19 pneumonia is a respiratory illness where the SARS-CoV-2 virus damages the airways and lungs. The immune response causes inflammation, leading to fluid leakage into the air sacs, resulting in pneumonia. Thank you for watching this video on the anatomy of the lungs. Let's revisit the case scenario of the 62-year-old male with COVID, falling oxygen saturation, and bilateral infiltrative shadows in the lower lung lobes. The physician advised prone positioning. Here are the questions raised by the case. What is the diagnosis? The causative microorganism. Why were the lungs involved? Which lobes were involved and why? Why did oxygen saturation fall? And why the prone position advice? The probable diagnosis is COVID pneumonia, caused by SARS-CoV-2. Lungs are involved because it's a respiratory disease. Lower lobes are most commonly involved due to the right bronchus being shorter and straighter. Oxygen saturation fell because the virus damages the alveoli and capillaries, thickening the walls and impairing oxygen transfer. Prone positioning was advised as it affects air distribution and volume in the lungs, aiding oxygen exchange.